Want to pass your NCLEX? Then let's get started, guys. Today we'll be covering 10 questions based on clinical judgment. Question 1. A nurse is caring for a client who has just undergone abdominal surgery. The client's vital signs are stable, but the nurse notices that the client is increasingly anxious and restless. Which action should a nurse take first? Administer sedative medication as ordered by the physician, provide emotional support and reassurance to the client, assess the client's pain level and medicate as appropriate, call the healthcare provider to report the client's anxiety. Pause the video and select your answer. The correct answer is B. Provide emotional support and reassurance to the client. Providing emotional support and reassurance addresses the client's immediate need for comfort and may help alleviate anxiety. You can pause the video throughout the series and look at the incorrect options. Question 2. A nurse is caring for a client who is receiving a blood transfusion. The client suddenly complains of back pain and difficulty breathing. Which action should a nurse take first? Stop the blood transfusion immediately, administer oxygen therapy to the client, check the client's vital signs and oxygen saturation, notify the healthcare provider of the client's symptoms. Pause the video and select your answer. If you selected option A, you are absolutely correct. Stop the blood transfusion immediately. Stopping the blood transfusion is the priority to prevent further adverse reactions. Question 3. A nurse is assessing a post operative client's surgical incision. The incision is red, warm to the touch, and has purulent drainage. Which action should the nurse take first? Notify the healthcare provider immediately, increase the frequency of wound dressing changes, collect a wound culture for laboratory analysis, administer prophylactic antibiotics to the client. Pause the video and select your answer. If you chose option D, you are correct. Administer prophylactic antibiotics to the client. Administering antibiotics is appropriate but should be based on the healthcare provider's orders after assessment. I know you may be tempted to have chosen C, collect a wound culture for laboratory analysis, but you can read the description below of why this answer is incorrect. Also, in the NCLEX world, it is assumed that the provider has already given those orders. Question 4. A nurse is caring for a client with heart failure who suddenly develops dyspnea, crackles in the lungs, and increased heart rate. Which action should a nurse take first? Administer diuretic medication as prescribed, elevate the head of the bed and provide oxygen therapy, assess the client's electrolyte levels, notify the healthcare provider of the client's symptoms. Pause the video and select your answer. If you chose B, you are correct. Elevate the head of the bed and provide oxygen therapy. Elevating the head of the bed and providing oxygen therapy can help improve breathing and oxygenation, addressing the acute symptoms. Question 5. A nurse is caring for a client who is experiencing a seizure. What action should a nurse take first? Move nearby objects away to prevent injury, restrain the client to prevent self harm, place a tongue depressor in the client's mouth, administer intravenous benzodiazepines. Pause the video and select your answer. Hopefully, you chose option A, move nearby objects away to prevent injury. Moving nearby objects away can prevent injury during the seizure and is the priority action. Okay, guys, we're halfway there. Let's keep going. Question 6. A nurse is caring for a client with diabetes who is experiencing confusion and diaphoresis. The client's blood glucose levels is 45. Which action should the nurse take first? Administer subcutaneous insulin as prescribed, offer the client a glass of orange juice, assess the client's vital signs, notify the healthcare provider of the client's symptoms. Pause the video and select your answer. The correct answer is B. Offer the client a glass of orange juice. Offering the client a glass of orange juice or another source of simple sugar is a priority to raise blood glucose levels quickly. Question 7. A nurse is caring for a client who is at risk for falls. What action should a nurse take first? Ensure that the client's call bell is within reach, place a bed alarm on the client's bed, apply non-skid socks to the client's feet, conduct a fall risk assessment for the client. Pause the video and select your answer. The correct answer is D. Conduct a fall risk assessment for the client. Conducting a fall risk assessment is the priority to identify specific interventions needed to prevent falls. Question 8. A nurse is assessing a client who has just returned from surgery and has a nasogastric tube in place for gastric decompression. The nurse notices that the client's abdomen appears distended and the nasogastric tube has not been draining effectively for the past hour. Which action should the nurse take first? Irrigate the nasogastric tube with normal saline, reposition the client onto the right side, assess the client's vital signs and abdominal distension, notify the healthcare provider of the situation. Pause the video and select your answer. If you chose option B, you are correct. Reposition the client onto their right side. Repositioning the client onto their right side can help facilitate drainage from the stomach by promoting the flow of gastric contents into the intestine. Question 9. A nurse is caring for a client with a history of COPD who is experiencing increased dyspnea and wheezing. The client's oxygen saturation is 88% on room air. Which action should a nurse take first? Administer a bronchodilator medication as prescribed, initiate oxygen therapy via nasal cannula, place the client in a high follows position, perform ABG analysis. Pause the video and select your answer. If you chose option A, you are correct. Administer a bronchodilator medication as prescribed. Administering a bronchodilator medication is a priority to help alleviate bronchoconstriction and improve airflow. Question 10. A nurse is caring for a client who has a history of congestive heart failure and is admitted to the hospital with worsening dyspnea, orthopnea, and crackles in the lungs. The client's vital signs are blood pressure 160 over 90, heart rate 110 beats per minute, respiratory rate 28, and oxygen saturation 88% on room air. Which action should a nurse take first? Administer oxygen therapy via nasal cannula, assist the client in a high follows position, administer a loop diuretic medication as prescribed, notify the healthcare provider of the client's symptoms. Pause the video and select your answer. The correct answer is A. Administer oxygen therapy via nasal cannula. This option is the most appropriate initial action because the client's oxygen saturation is 88%, indicating hypoxemia. Administering oxygen therapy is crucial to improve oxygenation and alleviate dyspnea in clients experiencing respiratory distress. It addresses the client's immediate physiological need for adequate oxygen supply and helps stabilize their condition. Congratulations on finishing these 10 questions, guys. Subscribe and join us next Wednesday.